When Will It Be Over? Read to you by Carol Brigham. Americans are asking important questions. When can we go back to work? When will schools open? How can we pay our bills? When will this pandemic be over? There is some good news. 240,000 Americans have recovered from COVID-19 as of May 13. Doctors have found a treatment that may help some people with COVID-19 get better faster. Many scientists are working to find a safe and effective vaccine against COVID-19. There are faster tests to find out who has the virus. Almost 8 million Americans have been tested. The government has helped small businesses with loans and grants to pay employees. The government has sent $1,200 to many American adults. It may send more in the future. It has supplemented unemployment insurance. Some people don't want to wait. Business owners want to reopen. People want to go back to work and school. They want to get haircuts, see movies, eat at restaurants, and have fun with their friends. Many people are frustrated. They are tired of staying indoors and not able to go to work. In some states, people are protesting against rules that keep stores, restaurants, bars, and barbershops closed. They don't want to stay home. They don't want to wear masks. Protesters say that the government has no right to keep people and businesses locked down. Rules for reopening. Dr. Anthony Fauci said that we have to continue the social distancing, staying home, and wearing masks in public. He said we have to have ways to test people. If someone tests positive, we need to be able to find and test the people they have been near. President Trump wants to restart the economy and pull the country out of recession. He has said that the coronavirus will go away by itself. Health experts say that is not true. Each part of the country has different levels of danger. The governors of each state will decide when businesses and schools can open. The CDC created guidelines for the governors. The guidelines give 3 conditions before a state can lift restrictions and open places for business. 1. The number of new cases of COVID-19 needs to decrease for 14 days. 2. Hospitals have all the equipment and beds they need. 3. There are enough test kits to test people for COVID-19. People who test positive can be isolated and not spread the disease to others. In Phase 1, some gyms, restaurants, and movie theaters can open with social distancing. Schools will stay closed. Workers should work from home if possible. People must keep 6 feet of distance between themselves and others. Restaurants may have 25% of their usual number of customers at one time. People must wear masks in public places. Phase 2 allows other businesses to open with precautions. This can only happen if there is no increase in cases 14 days after Phase 1. If Phase 2 goes well for 14 days, then Phase 3 allows other businesses, theaters, and sports events to open with restrictions. Can we save lives and the economy? Many states did not wait for 14 days of decreasing numbers of new cases. They do not have enough testing equipment or people to do the testing. They began to end restrictions early in May. Health experts say it is too soon to end restrictions. They predict that there will be many more cases of COVID-19. They remind us that people can have coronavirus without any symptoms. People can still spread the virus by talking, coughing, or just exhaling. In a store, you may be standing next to someone who's contagious but doesn't know it. All people should wear masks in public, not to protect themselves, but to protect others. The moment you relax, the number of cases will start climbing, said Dr. Ashish Jha, director of Harvard's Global Health Institute. As predicted, new cases of COVID-19 continued to rise in states where the governors did not wait. Is this the price to pay to keep the economy from collapsing? Many economic experts think so. Some Americans are not in a hurry to come out of their homes to shop or to go to restaurants, bars, or the movies. They are staying at home in order to protect people at serious risk. People over 60, people with diabetes, high blood pressure or obesity, and people in treatment for cancer or other serious diseases. That's 25% of all the people in the country. People in crowded conditions such as jails, nursing homes, and dormitories are at greater risk too. We don't have an easy way to return to normal, Illinois Governor J.B. Pritzker said. We have to figure out how to live with COVID-19. In Pritzker's plan, sporting events, conventions, and large gatherings cannot resume until there is a vaccine, a treatment, or herd immunity to COVID-19. Some bad news. The United States has the most COVID-19 cases in the world. As of May 13, there were 1.41 million cases of the virus. 84,000 Americans have died. The current rate of death is more than 1,000 per day. Prisons, nursing homes, and other crowded places have the highest rates of illness from COVID-19. Hundreds of small businesses will never open again. Large companies have gone bankrupt. 33 million people are unemployed. New York and New Jersey have had the most cases and deaths from COVID-19. That's because of the international airports that brought people to the U.S. from Europe and Asia. New York and New Jersey also have the greatest density of population. Congress passed 4 acts to help businesses and the unemployed. It cost $2.4 trillion. The government is $25 trillion in debt. Some experts say that there will be a lot more sickness and economic problems in our future. Others say that the country will recover in a short time and be better than ever. To subscribe to Easy English News, and for more information about what's going on with our company and other products by Elizabeth Clare, visit our website, elizabethclaire.com.